Good afternoon. Welcome to the Ohio Commission on Minority Health Month Application and Technical Assistance session. Today's pre-recorded session will be available to you on our website at www.mih.ohio.gov. It will be within our Grant Opportunities page, specifically listed under the Minority Health Month Grant Opportunity. To ensure that we allow proper time to show you how to enter your information into a Minority Health Month grant application, we will not review each slide verbally on today's presentation. You have the opportunity to stop, start, rewind, pause, whatever you need at your leisure. So with that, we will get started. For those who need a little background on Minority Health Month began in 1989 in the state of Ohio. It went national in 2000. Minority Health Month is a 30-day health education, prevention, and awareness campaign that's held in April of each year throughout the state and across the country, with a focus on targeting minority communities who are disproportionately impacted by chronic diseases and conditions. Specifically, the Commission on Minority Health is mandated to serve African Americans, Asian Americans, Hispanic and Latino Americans, as well as Native Americans. However, all of those attending any of our events, regardless of race or ethnicity, will be served, as all Commission events are free and open to the public. Entities who are eligible for Minority Health Month funding must be a public or a private nonprofit organization that has a 501c3 at the time of application. However, local health departments and health districts, you are exempt from this requirement. Therefore, you are eligible to apply for a Minority Health Month grant without having to provide a 501c3 letter. For further information about eligibility on how to ensure that you are in good standing with the State of Ohio Auditor's Office, please pause the webinar and read the following slide. With regard to funding for the Minority Health Month grant is available up to $2,500. Each grant must put forth a minimum of 2 separate events on 2 different days. For further information about each of the items that are necessary to implement a Minority Health Month grant, please pause and read the following slide or consult the RFP, also located on our website at www.mih.ohio.gov on the Grant Opportunities page. The submission deadline is also listed in the current RFP. Any application or supporting documentation submitted after the due date and time will not be reviewed. Hand-delivered, faxed, mailed, and emailed applications will not be accepted. Please allot sufficient time to submit your application. And given that this is a new system, we strongly advise that you allow enough time to have any of your questions answered. Questions are typically answered within 1 to 2 business days. Questions are not responded over the weekend, however, they are responded to on the next business day. You should also note that the submission of a technical assistance question about the system or a specific question about the RFP, no matter when the question is asked, it will not change the application due date. To learn and understand about the Minority Health Grants Management System training in general, such as how to register yourself as a user, how to register your agency, there's a pre-recorded message that's waiting for you on our website. It is also located on our Grant Opportunities page. It's expressly important to note that before you can begin the application process, you must register as a user and you must register your organization. For the full list of grant requirements, you're welcome to pause this particular screen or consult the RFP. Additional grant requirements are posted here. Please pause and read them at your leisure. Additional grant requirements are also listed on this slide. You may pause and read this particular slide, or you can consult our RFP. It should be noted that the RFP is the actual binding document that includes all the grant requirements, given that this webinar is not a required portion of your grant submission process. It's just here to be a little additional help for you. All of the information contained in today's webinar is available to you in the RFP. It is available to you in the Minority Health Grants Management User Guide, and it's available to you on our website in the Grant Opportunities page. With regard to general program guidelines, all the events that are scheduled must be held in April. They must provide a transference of knowledge or skill set, and you must make sure that you target, while everyone's welcome, you have to target the minority population. What's extremely important to note is that things happen. If it's bad weather or a venue is no longer available or a speaker is no longer available, we understand. But if your event must be rescheduled, you are required to inform the Commission immediately. Failure to notify the Commission of your program location change or your date and time change may jeopardize your agency's funding. You are also responsible for notifying the public in plenty of time to ensure they have time to change their plans to attend one or all of your events. Often we're asked, are we able to provide funding for an event within an event? Generally, that's not allowed because as an individual funded entity, you're provided with $2,500 to put forth your own 2 events in the month of April. However, exceptions will be considered on a case-by-case basis. For example, there is a Minority Health Month grantee from the past who sought to have a baby shower within a larger community event that was already taking place in April. That was allowed because the time of the event was a specific point in the overall health fair, community health fair, and had its own separate start time and end time, had its own participation, registration, and did not take away from the larger event. However, they were able to document their participants. They were able to report knowledge and behavior change, or knowledge change based on the information exchanged. So that particular sample of a baby shower within a larger community public event was allowed. Again, that's just one example. Those opportunities will be reviewed on a case-by-case basis, but again, that's the exception and not the rule. For general program guidelines, please feel free to consult the items here on this page. Further to general program guidelines, once your grant is approved, the scope of your grant cannot be changed without prior permission. We understand again, speakers may change or venues may change, which cause you to have to change how and when and where your event is implemented. This is allowed. However, your requirement of providing 2 events on 2 separate days still remains in effect. You just have to submit your new project idea in writing to the Commission prior to your event happening. Then that is reviewed, and if it's approved, then you're able to go ahead and continue planning and putting forth that event. But again, every Minority Health Month grantee must implement 2 different programs on 2 different days. Failure to submit those program changes I just mentioned in advance of them happening does jeopardize your funding. Well, we all know food brings friends and family. However, with the particular funding from the Commission, we are not able to provide refreshments or sit-down meals or catering services for this grant. However, you are able to implement food demonstrations through a registered and licensed dietitian. But that food demonstration must be participatory. They must have some educational materials such as a cookbook with healthy recipes and recipe cards. And it must also demonstrate an increase in knowledge for those who participated through a pre and a post test. So it's important that that type of demonstration be very much hands-on, and they're very well received. So it is absolutely allowable to have a registered licensed dietitian put forth a food demonstration with some educational components with it. Okay, moving on. Measurable outcomes. As a Minority Health Month grantee, we must still, as a state of Ohio entity, show that our grants have some degree of measurable outcomes. So some of those outcomes that you'll be asked to put forth in your final report are the number of people attending, perhaps their degree of change in their transfer of knowledge or skill, the number of people you've screened, and the number of abnormal findings you have for those that took place in health screenings. It's important that those who did have abnormal health screenings, that you break that information down by race and ethnicity. It helps us to document where the most need lies in a given community. What's also important to note is that if screenings are conducted, you have to provide the Commission with a plan on how your abnormal screenings will be referred to a healthcare provider. We don't want individuals walking off with, elevated blood pressure or glucose numbers and then not know what to do next. You can provide them with a referral list, or if they have their own healthcare provider, to really ensure that they go see that particular healthcare provider to let them know what their particular screening was for that afternoon. As a prevention program, we don't diagnose anything, but we just let someone know what their particular risk is, and we absolutely refer them for continued help. So plan ahead of time to be sure you're able to provide that to your participants. With regard to program marketing, the biggest piece to your event is to let folks know you're having it. Make sure it's accessible. As you're developing your marketing tools, please, whether that's radio spots or flyers or television spots, please ensure that you submit your content to the Commission for approval prior to incurring any expenses for your program marketing. It's also important that your program marketing include the following funding attribution: funded by the Ohio Commission on Minority Health. You're also able to include our seal. We prefer to have the wording funded by the Ohio Commission on Minority Health because it's a little hard to see the seal on some of the smaller items that are provided to the community with marketing tools. If you choose to have signage and banners and have those printed with commission funds, they should be of high quality and extremely visible with large font and brilliant colors. And they should not include a date so that you have the opportunity to reuse them in the future. What's very important to note up front is that this is a reimbursable grant, meaning that you are reimbursed at the conclusion of April and you've provided your program and fiscal report. Your fiscal report has the appropriate receipts or invoices to document spending. Once those are approved, then you are reimbursed for the amount you spent on your grant. However, in some instances, this prevents a particular type of burden. If you contact the Commission and just let us know that you would be experiencing a financial hardship as an organization if this were granted on a reimbursement basis, we will consider those requests on a case-by-case basis. With regard to general fiscal guidelines, the funding period is listed in the application. You will find further general fiscal guidelines on the slide that's here before you and listed in the RFP. You may pause or read the RFP and come back to the slide if need be. For a list of unallowable expenses, please do refer first to the RFP. Here is a list that's also provided as an example for expenses that are not allowed in the RFP. Rental of your own space, out-of-state travel, reimbursement for community health workers or interpreters, ink cartridges, interpreter fees that exceed 10% of your budget, or any food items that are not a part of an approved demonstration that we just spoke of earlier with the registered dietitian, or things such as games or other high-priced electronic units. Further to items that are disallowed, we are not able to sell any items at your commission-funded event. I know that vendors can also bring an additional flow of traffic through a given event. However, we don't want the community who actually really needs this event and who are disproportionately impacted by chronic diseases and condition. We do not want them to feel as if they have to purchase something or pay a cover charge or buy something to be able to attend your event. Even the perception of that through having other vendors, be they fun and health related, we don't want to discourage anyone from coming to your event. So there are no sales of any type at your Minority Health Month events. For further information on disallowed expenses, please read the remainder of the slide or consult the RFP. For general fiscal guidelines, you're welcome again to consult the RFP or pause and read the present slide. We'll now begin to enter the Minority Health grants management system to demonstrate an application in actual review. This is a fictional application that I'm going to show you, so you will of course enter your real information. My session has expired, so I will re-enter that information. Again, prior to your being able to enter an application, you have to register your organization and yourself as a user. Enter my password. And we're in. Okay. I am going to find my application that I'm going to demonstrate for you today. I think I'm actually going here. I'm going to search Minority Health Month, and forgive me for not having this pre-done, but it unfortunately times out for security purposes, which is really what you want. You don't want your information out and about. So I will scroll down to find my particular sample to show you. Okay. Here you will see on the left-hand side of your screen a list of the application sections. It will help you keep track of where you are in the completion of your application. You are also able to toggle between each of these sections should you need to. In the upper right-hand corner, you will notice a timer. This timer is here to help you understand the amount of time you have remaining before your session expires. Your session expires again only as a security feature, but as long as your cursor is moving and that time is counting down, it will continue to refresh every few moments so that you're able to continue to work in the system. If you were to walk away from the system or your attention is diverted, you'll have a warning when it gets down to a few seconds asking you, would you like to continue your session, as you saw on my screen just opened. You can then come back and of course say yes, continue your session, and you'll be logged in again. If you walk off and you are logged completely out, you'll have the opportunity to log back in, and then you'll be prompted through a series of text boxes or dialog boxes showing you how to retrieve the information you've entered on that page so that you don't lose it. The best way to enter and save your information is to remain at your screen and complete a given page all the way to the bottom so that you're able to submit. My particular application has already been completed in the system, so you do not see the submit button at the bottom. Were this a live application, there would be a next button located at the bottom of my screen. So the first screen that you will come to in your application will be the face sheet. You'll enter all of this obvious information into your screen. You'll want to use your drop-down menu to enter the appropriate state fiscal year. You'll see that my cursor, as I scroll over the boxes in this pretend application, it has already been submitted in the system. Your boxes will allow you to type into them. But again, this is a sample application, so I'm unable to type any additional content. So you'll enter your information into this section. Your application number will be grayed out. You will not enter your own application number. It will be generated for you. You enter your requested amount not to exceed $2,500. We've titled this program, and then we entered our executive director, project director, and fiscal officer into the appropriate data fields. The project lead will also be pre-populated with the appropriate commission staff, who will be the one to be the administrator over your grant. Were this to be a live application, there would be a next box at the bottom. You would click next, and then you'd be forwarded to the organization information page. This information is unable to be edited from the applicant. So if you see that you've made a mistake on the mailing address or that you've made a mistake in the telephone number, you will have to contact the commission at minhalth@mih.ohio.gov. Emailing your need to have information changed will then be able to be prompted to or provided to staff, and only staff administrators are able to go in and correct this information for you. But just by virtue of your entering your information in that email, we'd be happy to do so. Once this screen is completed, again, you cannot change any of the fields. There will not be a next button on this page as the items are pre-populated based on your face sheet and your organization registration. You can then click Proposal Narrative. It's here in the proposal where you would be able to type in your health areas and your demographics, the genders that you seek to serve, and all of that information. You would just simply check the box. So you're able to check about which information you'd like to implement. This particular grant chose to talk about cancer, diabetes, and substance abuse. They're choosing to focus on the African American community. And then they're entering the gender and the age range. And then you would go through and you're on this page and just answer the questions as they appear before you. The information that's included in the project description section of this page is merely test information, just to show you that the information is entered into a text box. Each of the text boxes has a character limit, meaning you have a certain amount of not words, but characters. So that includes letters, spaces, and punctuation. So you'll want to make sure you pay close attention to that. Once each question has been answered on this screen, you would hit the next button at the bottom of the page. Since my application is a test application that has already been submitted, there is no box at the bottom of my page. Your page will have a next box. You would then click on that and you would be navigated to the project action plan. The project action plan will allow you to enter the information about what you intend to do to ensure your participants learn more about diabetes or about cardiovascular disease or whatever the particular issue it is you are seeking to provide information to the community. So to view that, you can see here for the project model that every one of your diseases and conditions has to have a defined goal, a defined objective, approaches and activities, and then you're able to review those completely at the end. So for your project model type, for Minority Health Month grants, you have to click from this drop-down list, Other. The project model is Minority Health Month. The project description is you can just enter whatever the description is of your particular project. With regard to the type of interest, you will click on the drop-down menu and a number of different options for the type of interest will appear. It's access to community health services, it's several other options for you to select. You choose the one that's closest related to how you intend to implement your program. You then put in your start date and your end date. You have started your program in January, the program planning and implementation plans, but absolutely your end date does not go beyond April 30th because all your program plans have to conclude at that time. You would then click Next Section. From here, you would then define your goals, and you have to do what is required. I know that this says choose desired goals for this project model, at least one. For this particular model, there is only one required goal, but some of the diseases and conditions may have two. Others may have one as well. However many required goals are listed for your given disease and condition, you have to check the box that shows you will address it. This particular goal is about health awareness and disease prevention. You then go to the next section to define your objectives. And here you have to choose at least one objective. So this particular objective chosen was the number of people that will be reached to which they'll provide disease prevention information. You might have information on how you're educating the community on how those that are impacted by minority health are impacted. So you would choose the appropriate objective here. So in this particular application that's been submitted, we chose the second objective, and then we clicked Next Section. You would then go on to the following section, which would be to further define your evaluation for your objective. So you have to say how many of the numbers served will be able to reach this objective. So if you intend to reach 100 people, you're saying that out of this particular objective, you expect 85 of 100 people to meet this objective, or to be successful at meeting that objective. Your level of change could either be individual, community. You choose that level of change. If it's to a group of people who has to take a pre and a post test about their understanding of how to prevent cardiovascular disease, that's an individual level. If you are looking at trying to help discuss and change policy at the community level to be able to better provide minority health education and information at the community level, then you would check community. So you check the level of change that's appropriate for that particular objective for your organization. You then hit next section so that you're able to define your approaches and activities. And it's here that you put in the number that you project to serve. You put in the date of your event and the proposed days and times of that event. And you can continue to do that for however many activities you have selected. So again, you're going to make sure that for every type of approach that you select, that you enter an activity in the number projected. So maybe your approach is a community forum. Maybe it's a disease and awareness prevention campaign. Maybe it's an educational play where your characters are overcoming a particular of being at risk for a particular disease or condition. Maybe you're having a fitness run. So you're able to choose your particular approach and then tell us how many that you intend to serve with a given activity. And then from there, once you've done entering each of those, you would scroll down and click Next Section. And here's the review. You're able to see what your goals and your objectives and your approaches are and your intended numbers served. And then once you're done with that, you would then be able to click Done. And that will take you all the way back to this page at the beginning of your project action plan. And until the time that you submit your grant, you're able to review and edit your project action plan whenever you'd like, up until the point of submission. You then move on to your line item budget, where you'll see here that for every line item, you must enter a particular amount. For your purposes, you're not going to be an annual grant, so you won't have 4 quarters. So you're only going to have to enter information into one of the boxes to ensure that you're able to submit your budget. So as you can see in our sample here, that you are to enter your information into the last quarter, quarter 4, because you only, again, are going to be in operation for for 2 events, within 1 month. So you can enter all of your line items into the 4th quarter column. For each of the line items that you entered, you have to make sure that you enter a narrative in the box for each line item. You have several thousands character spaces for that, so there's plenty of room. The other column for this other funding is where you'll enter the amounts for your 20% match, because once you've finished entering all of your budget, you will have the amount you requested from the commission, and you will want to make sure that other column equals 20% or more, meaning that you've met that match requirement for the grant. You then click Next, and you would go to Project Documentation. Here you'll be able to see the items that are needed to submit along with your grant in the grants management system. You'll need to download the Civil Rights form, the Rehabilitation Act form, W-9 form, print them, sign them, and then upload them into your application. To upload, you simply come down the page. For example, to upload your signed Civil Rights form, you would come down to, this is a submitted application. There is a section underneath the document download that says documentation upload. You would find your document in that list. You would then click on that document and upload the document just like you would in any other system, and then save it to your application. Here you can see this particular applicant has uploaded all of their documentation. And please note that you will see a list of items that are required for the Minority Health Month grant to be submitted. They will have an asterisk by them so that you are ensured to download, sign, and upload the documents, and to make sure you have an accurate list of what's required to submit with the grant. So you'll see a red asterisk by the items that are required. But absolutely also ensure that you download, sign, and upload these 3 documents as well. You would then go on to signature page. Each of the individuals who are the fantastic folks that are implementing this grant clicked on the I agree button to document that by checking the box they are agree to the submission of this grant, and that they are either the executive director, project director, or fiscal officer of the agency. So they've attested to that by checking the box. They've also had to, each of them, download a signature form. So they'll click that open. They will download and sign this form. So what would happen, you'd print this form off, sign it, and then upload it into the system to be included with your application. And when you do that, it would be listed here in this area of your project, uploaded documents. And then after that, you'd go to the submit section and check all the minimal information on this page and be able to hit submit. And that is your grant package and the opportunity to submit your application in the Minority Health Grants Management System. So with that, I will move back, if you will, to my PowerPoint. Go back from the current slide. All right. And we will move along. So you saw the application sections, the face sheet, organization information, all the way through the grant submission process. It's important that you go through each page and answer all of the questions. As if you leave questions blank or you just type information in that says come back to respond to this later, make sure you go back and read that application, because you're going to want to make sure you responded in detail to every question. You don't want to lose points because you didn't finish each question or upload all the appropriate documents. So please do go back and check all of your application sections. Just some quick tips. Gather all the materials you need to submit your grant, prior to your sitting down. Make sure you keep an eye on that timer clock so that you know how to plan your time to either save on that page or keep working and clicking next to save all the items on a given page. That countdown clock is your friend. But remember, if you do time out or you walk off from your desk and you see that you've been logged out, you do have the opportunity to sign back in and retrieve your information that was unsaved. Again, clicking that next button at the bottom of the page is your safest bet and the most efficient way to save your information. Remember, fields with a red asterisk are required to be answered before advancing to the next section. The system will not let you advance if you have not answered all the required questions. Again, those character counts are important. You have a sample of items here that shows character counts. 5,000 characters for the abstract, which you all, don't have necessarily because you are just the 2 events in Minority Health Month. That's for our larger grants. But your budget narrative, each of those boxes for each of your line items has 3,000 characters. You have plenty of space. It should also be noted that it's the system to operate best. You need to operate in Chrome. Firefox or Explorer or other platforms don't work well, so be sure to use Chrome. With regard to the grant cycle, what to expect pre-award, at award, and post-award, you're welcome to read this slide. And the grant application deadline is listed in the present RFP, and it must be sure to be submitted by 11:59 on the due date of the application. Those that are submitted after that due date and time are not eligible to be reviewed, and that deadline is not negotiable. Even if you've asked questions or needed technical assistance, even up until that moment, you must leave enough time to have your questions answered within 1 to 2 business days. And please remember only your RFPs that are submitted before the deadline will be scored, and we want you to have the best application. So if you have any questions, please make sure you submit those questions in writing to minhealth@mih.ohio.gov, which is what you see here before you. As staff, we are only allowed to respond to questions that are in writing. So if you submit your question directly to staff members, you will see that we'll respond and say that we're going to shift those questions over for response to that MinHealth email address. That helps us keep all the questions in one location. Plus, if you ask a staff member, we may not be here. You don't want your questions sitting, especially as it gets closer to the application time. So please submit your questions to minhealth@mih.ohio.gov. And again, your questions will be responded to within 1 to 2 business days. So if you'd like to learn more about the commission or the other funding opportunities or partnerships and information that we have, you're welcome to stop on by if you happen to be in the Rife Center. We're on the 18th floor, or you're welcome to call at 614-466-4000, or visit our website at www.mih.ohio.gov. Look us up on Facebook or LinkedIn. If you'd like to become a part of our listserv, we'd love to have you join our listserv. You're welcome to request that at our Facebook or by phoning the office, and we'll make sure to add you to our listserv. So with that, you have all the information you need to submit a wonderful application in the Minority Health Grants Management System. Please do consult your RFP. Please do consult your applicant user guide, and please do consult this presentation as well as the MHGM presentation that helps you obtain your username and password, as you need that information and your organization registered before you can begin to enter your application. So with this, we wish you well. We thank you for sitting with us this afternoon, and we look forward to receiving your application. Thank you.